Good afternoon, Jason Roseberg. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, good morning. My name is Jason Rosberg, and I'm one of the clinic nurses here today. May I know your name, please?
My name is Mihiraa.
Mihiraa, could you tell me in your own words what has brought you in to see us today, and what is on your mind?
Well, I'm 39 now, and lately I've been thinking a lot about my legs. My mother and both of my older sisters have terrible varicose veins, the kind that are all purple and bulging. They always talk about how much their legs ache, and one of them even had a skin ulcer recently. I don't have any pain or visible veins yet, but I'm terrified that because it's so strong in my family, it's only a matter of time before mine look like that too. I want to know if there's anything I can do now before it's too late.
I can certainly understand why seeing your family members struggle with those symptoms would make you feel anxious about your own health, especially when you want to stay ahead of any potential issues. Mihiraa, it's very proactive of you to come in now. The purpose of our talk today is to explain how we can monitor your vascular health and what steps you can take to protect your legs. I'd like to begin by explaining why we recommend a venous clinical assessment, even though you aren't currently experiencing symptoms. The main reason for this assessment is to establish a clinical baseline for your vein health, which allows us to check your valve efficiency and identify any early signs of reflux, where blood might be flowing backward. We also use this time to assess your skin integrity, ensuring there are no subtle changes. These checks are a standard part of proactive vascular health, where we look closely for the development of tiny spider veins or any signs of edema, which is swelling in the lower limbs. Aside from the physical appearance of the veins, what other specific concerns do you have regarding your vascular health?
Is it just inevitable because of my genes? I try to stay active, but I work in a job where I'm on my feet for hours, and I worry that I'm just fighting a losing battle against my own biology. How do these veins actually become so damaged?
It's a very common feeling to worry that your genetics are a losing battle, but understanding the biology can actually be quite empowering, Mihiraa. To explain the physiological factors in vein health, your veins rely on a series of one-way valves that are designed to keep blood moving upward toward the heart. However, gravity constantly pulls blood downward toward your feet, which puts pressure on those valves. In people with a family history like yours, genetics can lead to naturally weakened vein walls, making it easier for those valves to stretch and fail over time. However, it is important to remember that while some of these structural changes are indeed hereditary, your lifestyle choices can significantly mitigate the progression of the condition and support your circulation.
That makes sense. But since I have to stand so much for work, I feel stuck. What are the actual requirements or changes I need to make in my daily life to stop this from getting worse?
I understand how worrying it can be to you, Mihiraa, but there are many positive steps we can take together to support your circulation. Since your job involves a lot of standing, we can focus on lifestyle changes that help your calf muscles act like a second heart. Regular exercise, such as daily walking or specific calf muscle workouts like heel raises, is essential because the contraction of these muscles naturally pumps blood back up toward your heart against the pull of gravity. It is also vital to avoid staying in one position for too long. If you must stand, try to shift your weight or take short walking breaks whenever possible. Maintaining a healthy weight will also significantly reduce the overall pressure on your veins. For your long work shifts or any future flights, I strongly recommend wearing medical-grade compression stockings to provide your vein walls with extra support. Finally, at the end of each day, please try to elevate your legs above the level of your heart for about 15 minutes. This simple act allows gravity to work with you, helping the blood drain easily and giving your veins a well-deserved rest.
I can definitely start doing those exercises, and I'll look into the stockings. But what happens next? Do I just wait and see if they pop up, or is there a more formal way to keep track of this?
That is a great question, and it leads us into the next stage of your care. Mihiraa, I would like to recommend a follow-up appointment or perhaps a specialist referral in the future. This is important for long-term prevention, early detection of valve failure, and discussing potential treatments if they ever become necessary. Moving forward, I recommend that you also engage in proactive monitoring. This involves self-checking for any feelings of heavy legs or the onset of night cramps, which can be early indicators of venous strain. It would be very helpful if you could keep a symptom diary to record any changes you notice. By staying vigilant and having regular reviews, we can ensure that we manage your vascular health effectively as you get older. How do you feel about starting that symptom diary and scheduling a follow-up in 6 months?
I think a diary is a great idea. It makes me feel like I'm actually doing something productive. I'm happy to come back in 6 months to make sure everything is still on track. Thank you, Jason. I feel much more relieved now.
You are very welcome, Mihiraa. I'm glad we could put a plan in place to give you some peace of mind.